Thank you, Steve, and it's a privilege and a joy to join you today from Bristol, Tennessee, at the headquarters of the Christian Medical and Dental Associations. And I bring you greetings from our senior management team, and our team has been praying for your conference today, and we're delighted to hear how well it's been going. And I appreciate the opportunity to take a few moments to talk to you a little bit about the Center for Wellbeing here at the CMDA, and to tell you a little bit about it. I came back to staff. I joined the staff in 2005 here at CMDA, and then left about 2008 and just came back about 2 years ago to relaunch the Leadership and Church Relations Department, and as well as to oversee the Center for Wellbeing. And at the time, the Center for Wellbeing was primarily a ministry coaching healthcare professionals, helping them move forward. It wasn't about counseling, it was about coaching. And what we began to realize because of the pandemic, so many of our healthcare professionals were at burnout and struggling with a lot of issues, as you can imagine. I'm sure you guys did as well. And so we kind of rebranded the Center for Wellbeing to talk about coaching and caring for healthcare professionals, because we realized that some of our healthcare professionals weren't at the place where they needed coaching. They just needed some care. And a lot of our ministry has developed over the last 2 years to kind of focus more on just sometimes listening. I got a call the other day from one of our members who's just found out she has cancer, and she has a long journey of kind of wrestling with that. And she wanted someone in our team to come along and just pray with her. She doesn't need coaching right now. She just needs someone to care for her. And we feel like the pastoral care aspect of helping, coaching, and caring for healthcare professionals is really, really important. So I encourage you to check out our website, cmda.org/wellbeing. A lot of resources we have on there, and we're continuing to add resources to that. But as Steve was saying, we've added a lot of ministries. We've been trying to be intentional and develop the Center for Wellbeing to deal with things that people are struggling with. In addition to issues like burnout and just some pastoral care, we've added marriage ministry, because we've realized that working in the healthcare profession can be very hard on a marriage. And so we have marriage conferences that we do. We're looking at expanding those to online marriage conferences, and even internationally. We would like to do those internationally via Zoom, just like this as well. We've launched a medical malpractice ministry. We frequently get people in the medical profession who are being sued. And if you've ever been through malpractice, if you've ever been sued, you know that that can be very damaging to your well-being. It can be a real struggle. Most of the time, our healthcare professionals are told, don't talk to anyone about this. You have to keep this to yourself. They don't feel like they can talk to anyone. But we like to come alongside them. We have an opportunity on our webpage. People who are going through malpractice can contact us immediately. If I was to get a phone call today, it would come to my phone, I could immediately contact those individuals and pray with them. And then we would line them up with a healthcare professional who would walk alongside them through the entire journey of their malpractice suit. We've also just launched a mentoring with a coach approach. Mentoring is a big CMDA KRA in our strategic plan. And we're trying to train up mentors, because you've got a lot of people going into healthcare, the healthcare profession, who have never been mentored. They've been well trained in the academics. They've been well trained in the medicine aspect of training, but having someone come alongside them and coach them and care for them and help them through some of the difficulties of life has been important. But then we also have the leadership and coaching. We have coach training classes that are available for all of you to take some of our 501 classes and our 503 classes. And then we have a team of professional coaches that kind of help people move forward in some of the things that they're struggling with. One of the new ministries that we're just launching and hopefully kind of bringing on board this week is a ministry we're teaming up with in Dallas, Texas, called 1212 Ministries. We've been getting a lot of comments and calls and inquiries from people within our membership about infertility. And some of our residents, medical students, we have a large medical campus. We're on 98% of all the medical campuses here in the United States, ministries for students and residents. And they're struggling in this area. And so one thing we realize is that if you're struggling with the loss of a child, or with this subject of infertility, then that could be a huge, huge issue for our members. And so we're launching as many ministries as we can under the Center for Wellbeing to take care of just pastoral care. When people ask me, I have a huge list of things that I'm responsible for, but when some people don't understand what my job is, I simply boil it down to this. My job is to be a pastor for healthcare professionals, and I love this role. Every day I get a chance to just care for our healthcare professionals and our staff here at CMDA and our members around the world. I have the opportunity to travel as the VP of Missions and Member Care, to travel to hospitals around the world and provide some coaching and counseling and caring for healthcare professionals. And so it's a delight to be with you. It's a little bit about the CMDA. I encourage you to look at cmda.org/wellbeing, and you can find out more about it. And my contact information is pbj@cmda.org. If you have any specific questions, I would love to answer those.